Speaker. And at the outset, I'm standing up to support the member for Wagga Wagga's bill. I think you put a lot of work into it. I have attended the event this week and spoken to many of the rural members that were present, as well as being immersed in the primary healthcare system myself for the last 15 years. And it is a very challenging space. I mean, you have a hugely complicated system where primary health is, segregated to be the federal responsibility, and our hospital system, is the responsibility of the health minister in this parliament. And I must say he's doing a fantastic job. Whenever you need assistance, him and the team, and I know Mel sitting over there, it is commonly that they will respond to you as quickly as possible and as you need. So I do at the outset say that we are working, across the chamber, and that's how it should be, because health, an individual's health is the foundation of their being, and when we're talking about primary health care, if you separate it out from the hospital system, we're talking about a system that is supposed to prevent, illness. It tends to manage chronic disease, and it's actually its action is to keep people out of hospital. And our action is to then, obviously, when it fails, is to then treat people in their acute response. And the entire system sort of downstreams to the emergency department. That's the point of contact, and then out into the hospital wards from there. And if primary healthcare gets it wrong or is unable to cope, it also shifts that budget responsibility onto the state. And I really do think that we need a more of a streamlined, and that's probably a word of the day at the moment, but we need a more appropriate response to how we can utilise other avenues that are already within our system. As an example, an extended scope of care. Bronnie Taylor, a previous Nationals member of the upper house, she introduced an extended scope for pharmacists. And it's been so fantastic to expand the availability of some of the products there. And as an example, women's UTIs and being able to treat that better, and access to the pill. That is really important. But we also have untapped allied health opportunities. My expertise is in physiotherapy, and the ability to write a specific scan or to increase our scope of practice is very important, because we can reduce the cost on our state system. In regions, and my area I can only speak for, but there are other areas that are impacted worse. And in our area, sometimes it takes 6 weeks to get a GP appointment. Now, that's immense. There's clear evidence that shows the earlier you treat an ailment, the better the response is, the better the recovery is, the less impost on the system. And those wait times, they can be applied to, surgery, both elective and urgent surgery. They can be applied to a run-of-the-mill sprain or strain that I might see. And all of those wait times correlate with a downturn in the response and the treatment efficacy. I think the other thing that we face is the availability of GPs in the primary health system in the regions. Continuity of care from the same GP helps to become more efficient. It helps to know your patient better, and it helps to pick up patterns of and trends of ailment that might not be very clear until you've seen a person a number of times. And when it comes to GPs coming into the regions, we see problems that you might not see in Balmain, as I just heard the previous speaker. GPs can't get schools for their kids. They can't get access to childcare. Sometimes they can't even get an appropriate house. And that's one of the things I will talk about. The Bellingen Housing Matters Action Group worked really closely with council and health, and they came up with a system where they would find a spare room in people's houses and and then be able to house a doctor, and just to make sure that they had appropriate staffing levels, and that's not just for a doctor, it was for nurses as well, and as they expanded the system there, it was a very place-based solution that I thought was really important. It really shows their keenness to keep their hospital open, because Hartley House, one of the wards in the Bellingen Hospital there, it was closed for an extended period of time, and they had trouble restaffing it, and I think that the local community there worked really hard together. When I'm talking about the north of my electorate, we've got Dorrigo MPS. It's got beds closed, it's got an aged care wing there, but no specialist dementia care, and difficulties staffing all of the beds there. We face a budget decision to make sure that we are, doing the best that we can for all of our small towns. Also, one of the major issues at the moment in, say, my hometown of Kempsey, we have had a step-down maternity, and as the Speaker's nodding, I know you know a lot about my hometown, Speaker, so, we've had a step-down to level 2 maternity service for an extended period of time, since 2023, and that means that women might get a level 3 service during the week, and if they happen to have their baby on the weekend, then they have to travel an extra 50 kilometres. They might then change their midwife. I mean, I know that there's an attempt to get a continuity of care, but they also then have that concern, that stress that they're not birthing in the hospital that they've been travelling to. They might not know what's happening, and that delivery might come at a time that was very, very rushed, and it might happen on the road or something like that. So, actually, not to mention that we've got Aboriginal women not being able to birth on country, and that also is a concern that we have. We need to make sure that we are addressing our cultural differences as much as possible. And there are many episodes of concern throughout that period, but I also do recognise the local health district who have been trying really hard to fix that, and I do honour the word from our staff there that the roster is improving and they're able to provide more security of service there. So I can't wait until that comes to fruition fully and we have a level 3 service 7 days a week. I spoke on Tuesday about the need for a drug and alcohol rehabilitation centre on the Mid-North Coast. At the moment they travel a long way, and again it adds a barrier, and there's been a proposal by Durry Aboriginal Corporation in Kempsey there to have a drug and alcohol rehab, and I do recognise Minister Saffin, who has already responded to me since then, and she's trying to bring together the ministers involved, and hopefully we can talk about a positive solution there. We do know that the pressure that our community is under at the moment with respect to running at full tilt all the time, everyone is trying to make ends meet. Sometimes that leads into an addiction, and the pressures that are placed on our families, we do not need another barrier to prevent them from seeking help. When it comes to what's working really well in the regions at the moment, I've got Maxwell Hospital is one of the hospitals in my area, and that has a Tresillian service, a standalone Tresillian service that is, supported by the LHD and Tresillian New South Wales, and we see, an intensive level of support in a parenting journey that might not quite be going well at first, and all of a sudden you get this intensive support. They stay inpatient there, and the child and family health nurses, the specialists in lactation, the psychologists, the paediatricians, psychologists, psychiatrists and the GPs, they all work together as a team, and it's so beneficial. I've been there, I've been on site, I've talked to families, and they all love the level of support that is provided there. One of the difficulties that we're having at the moment is the provision of advanced care paramedics into regions where we aren't seeing, support for an appropriate level of medication, appropriate numbers, because advanced care paramedics can save lives, and it's so critical that in regions where we have the tyranny of distance, we do need to see an expanded scope and practice there. We need to see investment into advanced care paramedics because they're a critical part. I guess the other one is elderly and aged care and the NDIS. They are both clogging up our hospitals from a federal responsibility. Any delay leads in deterioration. I mean, Speaker, I just seek a small extension.
The member seeks an extension of time, which will be 2 minutes. Is the extension granted? Extension is granted.
I appreciate the House's indulgence, and I think this is a topic that I could go on about all day, so I better keep it succinct. Yes, so, I think the added impost from areas that might not quite be working in the federal space, I would love to see significant reform in the NDIS. As a provider of NDIS services within my physiotherapy business myself, I see the positives and the negatives and the difficulties that they face. It is a challenging space, and the same with my aged care. Physiotherapy, as an example, you have many other areas of allied health. We can actually prevent hospitalisation. We can prevent that cost being pushed onto the hospitals if we're able to see those clients in an appropriate area. And it might just be for falls. I've provided many falls network classes over years, and you see the social isolation, the lack of muscle strength, the lack of balance maybe contribute to a fall, and if we're able to address that, then we can prevent the fractured hip and the significant consequences afterwards. The bill itself, I would say this bill creates accountability. It means health districts can no longer simply acknowledge the primary healthcare problems are federal and move on. But it also draws attention, which is really important, to those shifted costs that we're talking about. And also, I think that one of the key important things that I'd like to talk about today is that rural areas and the tyranny of distance, it really does affect us significantly. And I really thank the member for Wagga Wagga, because it has drawn attention to our plight, and I firmly support the bill.